Today I want to start by talking to you about something we often overlook. Those lines that suddenly appear on your nails and may be telling you more than you imagine. You may have noticed them and assumed they were normal, maybe from a minor bump you don't remember, or simply a part of getting older. But I want you to pause and think about this for a moment. What if those lines were your body's way of trying to get your attention? This is something many people don't realize, and that's why I want to explain it calmly today. In my medical practice, I've seen that nearly 70% of people who develop certain types of nail lines actually have a nutrient deficiency or an underlying health issue they didn't know was there. The sad part is that many of these problems could have been detected earlier if they had simply known how to interpret these small but revealing signs. I remember one older patient, let's call her Elena. She had been noticing horizontal lines on several nails for months, but didn't think much of them. She thought maybe it was the nail polish, or perhaps she had bumped her hands without realizing it. She carried on with her routine, feeling more tired than usual, but blamed it on her busy life. What she didn't know was that her body had been trying to warn her, silently, that it needed help. When she finally came to see me for other symptoms, we discovered she had a significant protein and iron deficiency that had been affecting her overall well-being for quite some time, and her nails had shown the first clue. And I want to ask you, has something similar happened to you? Have you noticed changes in your nails and ignored them because they didn't seem important? If so, stay with me, because those lines you're seeing may not be just a harmless detail. In the next few minutes, I'm going to guide you through a simple explanation of what your nails might be revealing. I'll explain what vertical and horizontal lines mean, when they're a normal part of how the body works, and when you should pay close attention because they might be signaling something deeper. We'll also talk about the health situations that can be related to these changes, from simple dietary adjustments to conditions that require more immediate medical evaluation. My intention is to help you understand when you can handle the issue at home and when it's time to stop searching online and see a professional instead. And there's something important you need to know right from the start. There is one type of nail line that you should never ignore under any circumstance. In just a few minutes, I'll tell you exactly which one it is, because this information could help you or someone you love. I'm Dr. Gabriel Mena, and I welcome you to my channel. Here we talk about integrative health, longevity, and simple natural habits that help you maintain physical, mental, and emotional balance. So take note and feel free to share this with your family and friends to help them improve their health. We upload new videos every day, so subscribe and activate the notification bell so you never miss any of them. Before we continue, if you find this content valuable, something as simple as liking or sharing the video helps this message reach more people who may truly need it. Thank you from the bottom of my heart for being here and taking care of your health. Now let's begin. Before we explore these lines in depth, we need to understand what nails really are and why they work as small health indicators. A nail is not just a hard surface that we trim or paint. It's a structure made mainly of keratin, the same protein found in hair. Each nail is formed in a hidden area beneath the skin called the nail matrix. This is like a factory that produces new cells that harden and grow outward. A full nail takes between 4 and 6 months to grow from base to tip, and this is essential to remember. What you see on your nails today reflects something that may have happened in your body weeks or even months ago. It's like looking at the rings of a tree trunk that tell the story of the tree. If you had a strong infection a couple of months ago, your nails may now be showing the consequence of that physical stress. Why does this happen? Because the nail matrix needs nutrients, oxygen, and stability to produce healthy cells. Any disturbance in your health, any deficiency or illness that interferes with that supply, leaves a mark on the nail as it forms. This has been known for thousands of years. Ancient civilizations and modern medicine agree that nails can help us understand what is happening inside the body. Even Hippocrates, the father of medicine, described changes in nails related to lung problems. It's not magic, it's pure biology. When the body faces stress, whether physical or emotional, it prioritizes vital organs and places nails and hair at the bottom of the list. That's why the first signs of lack of resources often show up there. Now, I want you to understand that there are 7 different types of lines that can appear on nails. Some are completely normal, others appear during temporary situations, and 2 of them do require immediate attention because they may indicate something serious. In the next sections, we'll explore each one in detail. Let's begin today with vertical lines, which are the most common and usually nothing to worry about. These lines extend from the base to the tip of the nail, following its natural growth. They may look like small, fine ridges. Many people have 1 or 2, and others have several on every nail. After the age of 30, most people develop some vertical lines, and they become more visible as the years pass. They're so common that they're considered a natural part of aging, just like expression lines on the skin. In fact, for people over 50, the unusual thing is not having them. But not all vertical lines are the same. Normal ones tend to be thin, shallow, similar across all nails, and stable over time. The ones that require more attention are different. They may be deeper, uneven, appear suddenly, or affect only 1 or 2 nails. The most common causes of harmless vertical lines are 3. The first is age, simply because the nail matrix gradually loses its ability to produce perfectly uniform cells, like a machine that has been working for many years and starts showing minor signs of wear. It's not damaged, it's just aging naturally. The second is chronic dehydration. If you don't drink enough water, your nails can become dry and develop these lines. Just like soil cracks after long periods without rain, something similar happens to a dehydrated nail. The good news is that this improves with better hydration and with creams or oils. The third cause is genetics. Some people develop vertical lines from a young age. If your older relatives had them, it's very likely you will too, without it meaning anything serious. In these cases, the lines tend to stay the same over time. They don't appear suddenly or come with pain, color changes, or extreme fragility. But when should you pay attention? If the lines appear suddenly, if only one nail develops a very deep line while the others remain normal, or if the lines come with discoloration, pain, or extreme fragility. Also, if they appear along with symptoms such as constant fatigue, weight loss, hair loss, digestive issues, or skin changes. In these situations, they might indicate anything from more serious nutritional deficiencies to hormonal problems or skin and circulation conditions. And here's where things start to get much more interesting. Horizontal lines tell a very different story and are often far more significant. In the next section, I'll explain everything you need to know about them, because this is where extremely valuable information comes to light. Before continuing, I invite you to subscribe to the channel, activate the notification bell, and share this content with someone who might need it. We publish a new video every day, designed to support your well-being, and I want you to always have access to clear and helpful information. When you notice horizontal lines, discoloration, or dark streaks on your nails, it's natural to wonder what your body is trying to tell you. Today I want to help you understand this clearly, because your nails can reveal important situations you may not have recognized yet. The first thing to remember is that these signs never appear by chance. There is always a reason behind them, and understanding that reason can help you make decisions that improve your health. Many people don't realize that nails can show exactly when a problem occurred inside the body. As I explained earlier, when a horizontal line forms, it indicates that nail growth stopped or slowed significantly at some point. Nails grow, on average, 1 millimeter per week, so if you notice one of these lines halfway between the base and the tip, it usually reflects something that happened 2 or 3 months ago. It's almost like your nails keep a record of the difficult moments your health has gone through. One of the most common causes of these indentations is severe nutritional deficiency. And I'm not talking about eating a little less than usual for a few days. I mean a significant, prolonged lack of essential nutrients. Protein, for example, is crucial to produce keratin, the material nails are made of. When the body doesn't receive enough protein, nail production slows dramatically. I see this often in people with very restricted diets, those with digestive problems that prevent proper nutrient absorption, older adults who eat too little, or those suffering from eating disorders. Zinc also plays a key role. When this mineral is lacking, horizontal lines can appear, nails may become fragile, grow slowly, or develop small white spots. Zinc is involved in repair, growth, and healing, which is why other symptoms often appear as well, like hair loss, loss of taste, or wounds that take longer to heal. Iron is another essential nutrient. When iron or hemoglobin levels are low, the body suffers in many ways, and nails are no exception. You may notice horizontal lines, very pale nails, brittle nails, or nails that lift at the edges, taking on a spoon-like shape. If you also feel tired all the time, experience dizziness, or notice paler skin than usual, it's important to check your iron levels to rule out anemia. The good news is that these deficiencies usually improve effectively with dietary changes or supplements prescribed by a doctor. As nutrition improves, the nail matrix returns to normal function, and new nails grow without those marks. Over time, the lines move forward and disappear when the nail is trimmed. But keep in mind that nutritional deficiencies are not the only cause of these lines. They can also appear after periods in which the body experienced intense physical stress. And I'm not talking about everyday emotional stress. I mean moments when the body enters an emergency mode, a very high fever lasting several days, a severe infection, major surgery, an accident, or a serious illness. During these moments, the body directs all its energy toward vital functions and temporarily slows nail growth. When recovery begins, the matrix resumes its work and leaves behind the line that reflects that difficult period. Some specific medical conditions are also associated with these lines. Poorly controlled diabetes can cause them because of fluctuations in blood sugar levels and circulation problems. Thyroid disorders, whether hypo or hyperthyroidism, affect so many processes in the body that even nail growth can be altered. Illnesses that produce high fever for several days, such as pneumonia or typhoid fever, often leave a mark on the nails weeks later. Chemotherapy, due to its effect on rapidly dividing cells, is another known cause. There are additional signs that deserve your attention. If the lines appear at the same time on all your nails and you do not recall any episode of illness or stress that might explain them, it is worth investigating. If you notice several horizontal lines, as if you had gone through multiple interruptions at different times, or if these grooves are so deep that it seems like the nail could split, these are reasons to seek evaluation. And if these lines come with other symptoms such as recurring fever, unexplained weight loss, or joint pain, a medical assessment becomes even more important. Some time ago, I cared for a patient named Mr. Ernesto, a 75-year-old gentleman who arrived worried because he had several horizontal lines on his nails and felt constant fatigue. During the consultation, he told me he had experienced a lung infection months earlier but did not think much of it. When I examined his nails, I knew something did not add up. The lines corresponded to different periods, as if he had gone through several moments of intense physical stress. I ordered some tests, and we discovered he had been dealing with anemia and an undiagnosed zinc deficiency. Thanks to that finding, he began treatment, and months later, not only did he feel much better, but his nails also started growing again without those marks. Stories like this remind us that nails do not lie. They reveal what the body sometimes hides. Now I want to talk to you about another sign that deserves special attention: dark or black lines that appear vertically from the base to the tip of the nail. Medically, this is known as melanonychia, a pigmented streak that can range from brown to almost black. This occurs when the nail matrix produces more melanin than usual. It is important to know that in most cases these lines are completely normal, especially in people with darker skin tones or those of African, Asian, or Hispanic ancestry. Many times these lines have been present since youth and do not indicate any illness. It is similar to having a freckle or a mole, simply increased pigmentation. However, there are situations in which these dark streaks require immediate attention. If you have fair skin and have never had a dark line on your nails and suddenly one appears, especially on a single nail, it is important to have a dermatologist examine it. It should also be evaluated when the line develops in adulthood, especially after the age of 40, or if you notice it widening or changing over time. And I want you to pay very close attention to this. If the dark color does not stay confined to the nail and extends to the surrounding skin, what we call Hutchinson's sign, it requires urgent evaluation because in rare cases it may be a subungual melanoma, a type of skin cancer that appears beneath the nail. I do not want to alarm you, because the vast majority of these lines are completely benign, but identifying them early can make a major difference. A dermatologist can perform a simple exam called dermoscopy to determine whether it is normal or whether a biopsy is needed. Beyond dark streaks, there are other nail changes that may indicate health issues and should not be ignored. Healthy nails have an even pink tone and a small white area at the base. When nails deviate from this appearance, it is worth paying attention. Yellow nails, for example, may be caused by frequent nail polish use, tobacco, or even fungal infections. They can also appear in chronic respiratory diseases or, in rare cases, in a specific condition called yellow nail syndrome, which is related to lymphatic and respiratory alterations. Very pale or white nails can indicate anemia, liver problems, or kidney failure. Sometimes small white spots called leukonychia appear, usually caused by minor trauma to the nail and generally harmless. However, when an entire nail appears very white, especially if it occurs on several nails, further evaluation is recommended. Bluish or purplish nails may signal circulation or oxygenation issues. This may occur in heart disease, lung disease, or circulatory disorders. If you notice this change without an obvious cause, such as exposure to cold, it is important to have it evaluated. Regarding texture, nails with small pits or tiny indentations may be an early sign of psoriasis or psoriatic arthritis. Spoon-shaped nails that lift at the edges are often associated with iron deficiency anemia or hemochromatosis. Rounded and enlarged fingertips, known as clubbing, may be connected to chronic lung disease, heart conditions, or inflammatory bowel disorders. When you notice that part of your nail begins to lift and a yellowish or whitish space appears, it is natural to wonder what is happening and how to fix it. That separation, which almost always starts at the tip and moves backward, is called onycholysis. Understanding why it occurs helps you act early and prevent complications that can affect nail health. One of the most common causes is using your nails as tools. Opening objects, scraping surfaces, or cleaning too aggressively weakens the nail bed. It can also occur when artificial nails are applied improperly, leaving the natural nail fragile and vulnerable. Fungal infections are another frequent cause. In these cases, besides separation, thickening and color changes often appear. From a medical perspective, onycholysis can also signal that the thyroid gland is working too rapidly. In fact, when I see this separation in multiple nails without trauma to explain it, I usually check thyroid function because hyperthyroidism can clearly show up in the nails. It can also be associated with psoriasis, reactions to certain medications, treatments like chemotherapy, or repeated exposure to chemicals. If you notice your nail lifting, it is important not to try to glue it back or cut the affected area abruptly. The nail needs to grow out completely from the base to recover. While this process occurs, it is best to keep it clean, dry, and protected to avoid infections. And the most important thing is identifying the true cause so it can be treated properly. Sometimes I encounter situations like that of a patient named Elena, a 70-year-old woman who came worried because several of her nails were lifting. She thought it was due to age, but as we talked, she mentioned she was using cleaning products without gloves every day. Her nails had weakened from repeated exposure to water and chemicals. We made some adjustments to her habits, and a few weeks later, her new nails began growing in firmer and healthier. Small changes can make a big difference. Now, you may be wondering when you should stop looking for information on your own and consult a professional directly. The answer is simple. When you notice changes you cannot explain, when the issue affects multiple nails, when there is pain, inflammation, texture changes, color changes, or when a nail separates without an obvious cause. In these situations, medical evaluation is essential. As for prevention, there is a lot you can do every day. Your nails respond directly to what you eat. Protein is essential because keratin, the material nails are made of, comes from it. Including a quality protein source in each meal helps your nails grow strong. Iron is also crucial. When it is lacking, nails become fragile and may develop lines, ridges, or structural changes. Eating iron-rich foods such as leafy greens, legumes, and lean meats improves these aspects. And when you pair these foods with sources of vitamin C, your body absorbs iron even better. Zinc plays an important role in growth and repair. Biotin, or vitamin B7, strengthens nails from the inside. Omega-3 fatty acids help maintain flexibility and prevent nails from becoming dry or brittle. calcium and vitamin D also contribute to proper nail development. Supplements can be useful if there is a real deficiency, but they are not always necessary. Ideally, nutrients should come from real foods. Before taking any supplement, talk with me or another physician to avoid excessive intake that could cause harm. Hydration is another factor often overlooked. Drinking enough water each day keeps nails elastic and resilient. When the body is dehydrated, nails become dry, brittle, and more prone to developing lines. In addition to nutrition, your daily habits matter greatly. Treat your nails gently. Avoid biting them, as this can damage the growth matrix. Cut them with clean, sharp tools, following a straight line, and avoid cutting them too short. File the edges gently to prevent snagging. Protect your hands with gloves when using cleaning products or working with soil. Repeated exposure to chemicals, water, and detergents weakens the nail and the surrounding skin. Moisturize your cuticles and hands with creams or natural oils before bed or after washing your hands. If you use nail polish, remember to take breaks. Avoid leaving polish on for weeks without allowing your nails to breathe. Use a protective base coat before colored polish and remove it with gentle, acetone-free products. When going to a nail salon, ensure they maintain strict hygiene, do not reuse instruments, and avoid cutting your cuticles aggressively, as these are a natural protective barrier. It is also important to care for your overall well-being. Chronic stress, lack of sleep, or a sedentary lifestyle affects how your nails grow. Getting enough sleep, staying active, and finding time to relax benefit both your nails and your general health. Avoid smoking, as it affects circulation and stains the nails. I recommend examining your nails carefully once a month, especially when trimming them. Spotting early changes allows you to act promptly. Knowing what your nails normally look like helps you identify when something is off. Throughout this video, we have gone through signs and changes that often go unnoticed. Now you have clear tools to interpret what your nails may be telling you and make decisions that support your health. If after hearing all this information you notice something that concerns you, do not hesitate to seek medical attention. No question is too small when it comes to your well-being. If you realized your diet could improve, start today. You do not need to change everything at once. Begin with small steps, add a serving of protein, include leafy greens, drink more water. Your body will thank you, and your nails will show the difference in a few weeks. I would love to hear from you. Tell me in the comments if you have noticed any of these changes in your nails or if you learned something new today. You can also suggest other topics you are interested in. I always enjoy guiding those who want to take better care of their health. And before I say goodbye, I want to invite you to subscribe to this channel by Dr. Gabriel Mena, share this content with someone who may need it, and activate the notification bell so you never miss new videos. We upload content every day, always with practical information to help you better understand your body. I also want to invite you to take a moment and thank God for life, for the chance to learn, for the health we have, and for the possibility of improving it through daily decisions. Every day is a gift, and taking care of ourselves is a way to honor it. Here on Dr. Gabriel Mena's channel, we are grateful to accompany you, help you understand these signs, and encourage you to improve your habits. Tomorrow we will have a new video with more useful information for your well-being. I look forward to seeing you, because your health matters to us, and you will always find a place here to learn and take care of yourself.